Hi ladies and gentlemen, this is Fruan Lampman from Key Wealth, and in this video we're going to have a quick overview of the B2 savings option with Bestmed for 2023. So first of all, please note that there is a non-network option, meaning it's any hospital, and we have a network option, meaning it's only network hospitals. This option comes in very affordable, with the network option being only 2,090 Rand for 2023, and then 1,624 for the first adult dependent and 879 Rand for child dependent. Take note that you only pay for 3 children, so from the 4th child onwards, it's for free, and you only pay for it stays child dependent rates up to the age of 24 or 26 if they're studying towards a qualification. In hospital, your stay in hospital is covered. Take out medicine or take home medicine is covered up to 7 days. Take note that this benefit has to be issued from the hospital pharmacy. In other words, the hospital's own dispensary or their own pharmacy, not a pharmacy within a hospital's building. So that's very important. There is a limit of 15,855 Rand on biological medicine within hospital. You've got your 21 days in a mental health clinic. Your consultations with doctors and surgeons will be covered at 100%. Should these, remember they can charge above 100%, and should that be the case, this is where you require a gap cover. So reach out to us and we can make sure you've got the best cover in place. I'm just going to go through what's important here. So first of all, newly added on here is your artificial discs. This was an exclusion up to 2022, so from 2023 onwards it will be covered. There are limits on internal prosthesis. If that limit is not enough, you can claim a set amount from your gap cover, so make sure that you've got the right thing in place. Your major medical maxillofacial surgery is not covered. That means your jaw and lower facial surgery. So very important, if you require that, it's not covered. It's only covered under PMBs, and something that's here is wisdom teeth. So if you need to remove your wisdom teeth, this will not be the correct option for you. You've got in-hospital oral and dental surgery. This is for children that's 7 years and younger, so not for adults, only for children, and they cover it up to 5,782 Rand. So very important to take note of that. Also, you've got an exclusion on your joint replacements. This is a total replacement of a joint, hip, knee, and other minor joints. They will, however, cover it in a PMB scenario. In other words, if it's like a vehicle accident or trauma, but not where it's wear and tear or because of old age. So inside of hospital, blood tests are covered, radiology is covered, your MRI and CT scans are covered, you've got cover for cancer. Please take note that you can upgrade with Bestmed should you be diagnosed with cancer and your current plan like B2 does not provide you the best cover, or it's not fit for your treatment plan. You can upgrade within 30 days. Your confinements are covered, refractive surgery, PMBs only. They do midwife-assisted births. So many things that you can go through here that is covered in full with Bestmed. You do have access to international travel cover, and then take note that there's a 13,078 Rand copayment. If you're on the network option and you go to the wrong hospital, you can claim the largest part of that back from your gap cover. So again, reach out to us and make sure you've got adequate cover in place. Out of hospital, the Bestmed Beat 2 has a 15% savings account. We'll get to that in a moment. But your family practitioners, basically your GP, your specialist consultations, all of that is paid from your savings account. And then you do have these 2 primary care consultations at a Dis-Chem pharmacy if you are a diabetic. You do have your basic and specialized dentistry will come out of your savings as well. Basically everything comes out of your savings except for your preventative care, which I'll show you in a second. You do have a benefit for out-of-hospital MRI and CT scans of 5,885 Rand. To make an example here, if you do go for a scan and it's 15,585 Rand, Bestmed will cover the first part. The other 10,000 Rand can be claimed from a gap cover. So again, make sure you've got adequate cover in place. You do have access to your chronic medicine. Please note there's a formulary. If it's not on the formulary, there's a 30% co-payment. Everything else will be covered from your savings account. Here's a list of the chronic conditions that are covered. You can pause the video here to go through it. I'm going to mention some of the most common ones, which is asthma, bipolar, diabetes. You've got your hyperlipidemia, which is high cholesterol, hypertension, which is blood pressure. You have things like endometriosis, which is also kind of common. So all of those can be covered under your chronic benefit. The preventative benefits, note this is not paid from your savings. So everybody has a flu vaccination once a year. If you're in a high-risk group, you can also get a pneumonia vaccination, your travel vaccines, which is kind of nice. Very important here, something that's very costly is Bestmed Beat to pay for pediatric immunizations. Please note this is the state recommended program. In other words, there are certain immunizations that won't be covered. I think there's only 2 that's not covered. The rest are covered in full, so that is a great benefit. You've got your 3 assessments for your baby growth and development, and then fantastic is your 2,500 Rand benefit for female contraceptives. So you can get contraceptives on your back and neck is to prevent surgery. So if you qualify for that, it's a great program to try and not go for a back or neck operation. You also have your HPV vaccination, so that's very, very nice. And then you have preventative dentistry. We'll go into that in a bit more in a moment. You've got your PSA screening, that's prostates for the men. Once you're over 50, you can go every 2 years. And pap smears, if you're older than 18, every 24 months. Very nice about this is it's once every 2 years. Most schemes cover it at once every 3 years. Just remember that with these preventative benefits, if I can take this pap smear as an example, the pathology test, the actual pap smear, that will be covered, but the consultation will be paid from your savings account. So just take note of that so that you can prepare for that. You've got the Tempo Wellness Program. Once you've done all of these health checks, you get access to these benefits. Basically, it's a fitness consultation with a biokineticist or a nutritional consultation with a nutritionist or a dietitian. You do have maternity benefits, so 6 antenatal consultations, 2 scans, and you can register for the baby program. Once you've done that, they will also send you a free gift, so that's very, very, very nice. Preventative dentistry, this is a great add-on benefit. If you are 12 years and older, you can go for 1 consultation a year. 12 years and under, 2 consultations a year. You can do a full mouth intraoral radiographs once every 3 years. Intraoral radiographs, 2 photos per year. You can do your scaling and polishing. Please take note here, it's twice a year. So even if you're in a Bestmed will pay for 1 consultation, but you can still go for 2 scalings and polishings, 2 fluoride treatment to make those teeth nice and strong, visure sealings, spacers, and space maintainers. So nice benefit to check out your teeth and clean it. Just take note that all fillings, extractions, and anything else will be paid from your savings account. And that's it, ladies and gentlemen. I hope this was helpful and insightful. If you've got any questions, please reach out to our office. I'll put the details down below. There's also a link you can click to get a quotation and also a link you can click to book an appointment. Have a good